I'm Ellen Wright. I'm a GP and pain specialist, and I've been running this community pain clinic since 2009. One of the reasons I set it up was I could see the need for something in the community for patients with chronic pain. About 2 years after we started the clinic, I was approached by Dr. David McGavin, who came to see me and asked if I wanted to collaborate with a charity that he was running that also could look after chronic pain patients in a more holistic way.
We're used to taking patients who aren't able to succeed with other methods or who are not expected to succeed with other pain management methods. And so we're used to having people with quite complex needs which are influencing their lives just as much as the pain, and sometimes more than the pain is.
He already had successfully piloted this approach down in Kent in his clinic in Maidstone and got very promising results. And he offered to work with our patients to see whether they could benefit from this type of approach.
The eurythmy is a movement therapy which is used in the chronic pain very much as a way of helping somebody befriend their body again. Because when all movement is related to pain, one comes naturally into a conflict relationship with one's body. And so to learn how to engage it, how to work with it, is seen as very empowering by many to cope with their situation. In the social activities, we started the choir. One of our patients had learned that it is a good thing with depression to sing, and because you would breathe better and so on, that would help energy levels.
We began to develop a number of social activities locally. The choir was the first one, where people could begin to get together and listen to each other, be listened to by someone who really understands what it's like to suffer pain. Patients are very resourceful once those resources can be freed up, and they're not aware often of what they're holding in terms of talent. And the first stages of this treatment program are really aimed at helping them to begin to mobilize themselves to begin to act. So they need to be helped to sleep properly. They need to be helped to move, and this gentle eurythmy movement that we have in the clinic is very helpful in that regard. And then they can begin to feel more secure in their body, more confident in their body. And if they come to a place where they know the people, because they're meeting the same staff all the time, and they know they're going to have sufficient time to be listened to and to begin to learn the new ways, the new tricks in a way, they can then feel secure enough to begin to move on.
Since David and his team joined forces with our clinic, it's given us an enormous extra range of therapeutic options. In particular, it's really enabled us to tackle the problems that often go together with chronic pain. These are problems like social isolation, employment problems, just patients becoming extremely debilitated and tired after years of suffering from chronic pain.
But this is really not a social prescribing that we're doing until they begin to start saying, right, now let me free because I want to take part in this craft group and I haven't got time for therapy. I'm feeling so much better. But that initial therapeutic stage is vital because you can't really encourage people into social activities. It would be bullying them really if they can't move, if they're too tired, and if they can't sleep. They're in a state really of torture.